This is Resolving Foot Problems Naturally, and I am DL Walker. Email is dlwalkerconsultant, and my website, dlwalkerconsultant.com. And I call this corrective functional foot treatment and beyond. And the reason why it is beyond is because foot problems or things that manifest in the foot are oftentimes not caused by the foot. In fact, I was working with a youngster here today who had pain in his ankle, and his dysfunction was in his calf. And when we treated his calf for just a few minutes, the pain in the ankle went away. This is because of connective tissue. So that is one of the reasons why I say it's corrective foot treatment, but beyond, as well as looking at a holistic mind-body energy approach. And so I'm going to talk a little bit about my experience and how I came to practice this way. Back in 1985, I had warts on 7 out of my 10 fingers. And I tried going to a doctor, a dermatologist, who tried various different painful treatments that did not work. And I was fortunate to be referred to a chiropractor who changed my diet and did things like laser and adjustments. And in 3 months, they were gone and never came back. And fast forward in 1995, I was in my second year of physical therapy school, and I learned 3 key principles of treatment. And I'll get into those a little bit later, but these are super important for professionals, and I use them every day. And I'm going to be sharing the principles with you. In 1998, I discovered my mission, which was to empower people to help them to heal. Ideally using online technology, which was at 1998 very, very new. In 2008, I began teaching balance enhancement and fall prevention to other physical therapists and healthcare professionals. And that's where I learned a lot about the foot, because most people don't fall when they are sitting. So I knew the foot was super important, and that's what brought me to that. And in 2015, I created my first online program called the Bunion Solution. So I started with bunions, and in 2022 began formal energy medicine study. And so I undertook a modality that uses frequencies and other types of energy-related modality. But my formal education is I have degrees in physical therapy, cardiac rehab, and exercise science, as well as fitness. And post-professionally, I was certified as a functional manual therapist through the Institute of Physical Arts, also health coaching and activator energy certification. That was the energy modality that I undertook. And why did I choose the foot and ankle? It's because it's one of the most important functional structures in the body. You know, we walk to get around, so the feet are integral. And the alignment of the feet, much like the base of a home, will affect everything above it. And I really felt that there's a need for an integrated, multidimensional approach, which is not conventionally offered. And my mission is to help resolve pain and suffering in at least 1 million people, and to empower them, to help them heal themselves, and to facilitate an atmosphere of collaboration among professionals to serve the public as a team. I believe in collaboration, not competition. And if anyone is a foot professional or a professional and would like to collaborate, I am more than interested. And I believe that a healer is not someone that you go to for healing, but a healer is someone that triggers within you your ability to heal oneself. So I consider myself a facilitator, and my goal is to, again, empower you with the skills that I have learned, because they're really not all that difficult the way that I present them. So what do? I like to get people back to their lives ASAP. I have no tolerance for pain within my own or feeling unwell for myself. And I use a multidimensional approach of the following: release, realign, rebalance, reinforce the body, mind, and energy. And because when there is dysfunction, when there is illness, when there's something going on, Oftentimes, it's a combination of all three. There is typically a root cause from one of them, and depending on how long it's gone on, it will go ahead and permeate to the other two. And I put this picture of a kitchen sink because I believe that I have a kitchen sink kind of philosophy, which means that when I am feeling unwell or challenged and I'm working with a client or a patient, I throw everything I know at it. I've been known to say that I will stand on my head and spit nickels if I thought it would help someone. So I try everything. And as a result of that, I have a very high success rate because I don't limit myself with what I've been taught. I've come up with the majority of things that I will be teaching you as a result of the challenges that I faced in my over 30-year career in healthcare. Well, a lot of this goes back to alignment. Alignment is the principle that foot professionals and professionals will strive for, be it a surgeon, be it a orthotist or a podorthist, a physical therapist, a chiropractor, a podiatrist. We all want to improve alignment, and I'll share why in a little bit. But the alignment of the body will change, and the ways that it will change is to do one of two things. One, to maintain balance. So if there is a reason, like a leg length discrepancy, for example, that causes us to be unbalanced, our alignment will adapt to that by making changes in our spine, for example. Okay. And also the alignment can change with regard to and in response to the forces that are acting on it. So the foot has forces from the ground, right? That's our footwear, such as high heels or, zero gravity shoes or anti-gravity shoes, or from above. And that's our posture. That's the body weight coming down onto our feet. And the number one alignment, compensation, or balance in the body is to shift the body weight and put it into the big toe. I actually believe that this is why children are toe walkers, that they are trying to get more proprioceptive input into their big toe. And also, when people present with what is seemingly a flat foot, it's actually the body's way of creating weight bearing onto the big toe for balance, because the big toe is the primary balancer in the foot. So I have a saying that we are a manifestation of our compensations in, obviously, body, mind, and energy. So the way that we present right now is because of our compensations. So there could have been, a stubbed toe, for example. This is a key one. And because of that trauma to the big toe, and I had this, as a matter of fact, I went kickboxing one day and avulsed my toenail. The toenail came completely off. And as a result of that, I compensated because I didn't want to put weight on my big toe because it was sensitive. Years later, as a result of not putting weight onto my big toe, I lacked stability in my knee. And when I missed a step, about a month after giving birth to my daughter, I wound up tearing cartilage in my knee. And when I was able to prevent that surgery, it was because the root cause was the big toe as a result of that trauma, probably 10 years prior to it. So when individuals have arthritis and then get like a joint replacement, oftentimes those compensations are still there. And I almost feel that that's why those joints, even the replaced joints, don't have what we consider to be a long shelf life. And compensations are adaptations of forces and physiological traumas that I mentioned, habits, and or a compensation of all of those things. So there could have been a trauma, like I mentioned, or it could be poor posture or being on your cell phone for a long period of time. And the idea, the first step in my formula, is to free restrictions in energy, mind, and body, whichever one comes. Usually I do this first, not always. There's one diagnosis in particular with anybody who has an itis. I don't always release first, but it's within there to go ahead and do that. And Tony Robbins recently, in his Time to Rise Summit, said that there are 3 keys to a breakthrough. The first is changing your state, then changing your story, and then finding a strategy. And he goes on to say that if you're not in the right state, you will never find the right strategy. You'll block yourself from doing so. And here's another quote by Albert Einstein, is that energy cannot be created nor destroyed. It can only change from one form to another. And so what happens is that if there is trauma, it gets absorbed into the body. Trauma to the mind and trauma to the energy. All 3 of these things are possibilities of reasons why somebody may be dealing with pain of any kind. So how do we change our state? That's changing our energy. And I'm going to give you some examples, but here's one from Tony Robbins' course. And this was based on research done at Harvard, where individuals, even just standing in a Superman pose or a superhero pose with the hands on the hips and the chest out, will change the hormones, will increase testosterone in the body. And there is a very famous physical therapist by the name of Stanley Paris who used to say that posture reflects our attitude toward life. So if we are sitting in a slumped position, which I'll go ahead and ask you to do right now, go ahead and slump down, bring your head forward, jut it forward, see how you feel in your body. Now go ahead and stick your chin out and try to swallow a piece of imaginary food. Now, go ahead and sit up straight, tall, aligned, chin level, and to repeat. See how you're feeling in your body. Go ahead and try to swallow a piece of imaginary food. It's a big difference. So what we're going to do is we're going to kind of look at a baseline determination of something just like calf flexibility. This is a runner's stretch. It's something that we do all the time. And what I will have you do is go ahead and mimic that. I'll do the same against the wall. And I want you to feel into your body. Feel where you feel that stretch. Is it a big stretch? Is it a little stretch? Rate the intensity on a scale of 1 to 10. You could try your right foot, your left foot. One will be very different than the other. So I'll go ahead and take a moment to go against the wall. Place one foot behind and lean forward. Make sure that your toes are pointed forward. And now I'm going to have you try a couple things. The first thing I want you to try is I want you to push your big toe into the ground and then see if that changes things. Do you have more flexibility when you do that versus when you don't? Any difference? You can try it a few times. Coming in, put weight into the big toe, and come forward even further. Okay? So how many people, if you could show your hands, how many people felt a difference between placing and pushing the big toe into the ground versus not? Yeah. Very good. Anybody else? Yeah, good. There was a difference. That goes into a principle that I learned back in 1997, stating that you need to have stability in order to have mobility. So for those of you who might have something like a plantar fasciitis where they advocate stretching, right? It could be that you have flexibility, you just don't have stability. So we have to look at both. The same thing with a diagnosis like hallux rigidus. It could be that you lack stability, which is why you lack range of motion. It might not be flexibility. More than likely, it's probably a combination of both. And there's a very key principle that I've shared in videos about inflammation. Inflammation causes instability. For every cubic centimeter of inflammation, a muscle will shut down by 1%. And the muscles that are responsible for stabilization are the muscles that are closest to the joint, which are most affected by inflammation. So when there is a trauma, a surgery, right, a stubbing of the toe, dropping something on your foot, there is an inflammatory process that requires, right, a restabilization in order for that mobility to come back. Does that make sense? Everybody understand that? Key important thing. So it is important when our healthcare practitioners recommend a anti-inflammatory or an injection to help with inflammation. It's not always a bad idea to do that, provided that you then take advantage of that situation, that new environment, and deal with the inflammatory process that's going on. But if you're just taking an anti-inflammatory and you're not doing anything to help the problem, to help that stability, then honestly, when that pill wears off, you're going to go back to where you started. And I call that a pill without a plan, right? You need to have that plan in order to become better. All right, I will go back. Emotional energy can manifest in our bodies. Okay, this is something that, again, happened to this 83-year-old woman with neck pain. And what wound up happening is that when she did meditation, right, which is done now pretty more conventionally than in the past when my career first started, and relaxation, she was able to realize that she tensed her neck for years during the stresses of being a caregiver. So we know this, that you could have stress in your body where your muscles are getting tight. I remember a patient of mine, with horrifically hypertone in her shoulders. And it was all because she wasn't breathing properly, right? When you breathe through your diaphragm, which is the muscle that is designed for breathing, then you don't need to use the accessory muscles for breathing unless you're, running at a fast pace where you would require your shoulder and your neck muscles. When we hold ourselves in postures, reflects our attitude towards life. If we're stressed, we're going to hold ourselves in a very tight posture. And what happens to our connective tissue is that when they are placed in a certain position for a prolonged period of time, that's how they stay. So doing a scan, tuning in, and there's a patient that I bring up a little bit later who was a clear example of this. Some of you may be familiar with the work of Brene Brown. She is a PhD social worker, and she talks about stockpiling, and that is emotional energy, emotional stress. It's holding on to hurt until it begins to manifest in its body. And she says that the body keeps score and it always wins. I like that quote. And there are some books, Louise Hay, Heal Your Body, and also You Can Heal Your Life. Those are two of her books. The Healing Question Guide and The Secret Language of the Body. These are resources that I share with people. I recommend doing what resonates. If it doesn't resonate, don't do it. But I do encourage people to be open to taking a look at these possibilities. Because once again, I don't think oftentimes a diagnosis is all in one's mind, but having body pain can mess with your mind and can cause some perpetual changes, certainly in our energy and our mindset. And this is another thing that I have realized and understand is that problems don't just go one way. So if the mind is capable of creating disease, it's capable of curing them. And there is something called convergence disorder. I had a patient early in my training when I was a student who presented with paraplegia. But on diagnosis tests, she had no evidence of a rationale or a reason for that. Yet her body, she was not faking it. You cannot fake these things. And then there's the placebo effect. It's that 35% of all patients given a placebo will get better. And that, to me, talks about the importance of mindset. And I believe that that is an important area to address, particularly when other things have not worked, for sure, at least to take an honest look at. So there are energy in our words that reflect our mindset, that are disempowering. And disempowering words and thoughts and beliefs are stored, I believe, in our body and perpetuate a problem. And so when people say nothing works, I've tried everything, those are not empowering. That is not helping you get to your resolution. Another one that is a pet peeve is when you say you have a bad foot, you have arthritis, you're taking on responsibility, you're taking on possession of a particular thing, and you have been given a diagnosis. There's a very big difference between the two. Obviously, our nonverbal communication, our posture, like we spoke about with the hormonal changes, and our breathing can impact our mental state, like I said, hormonally, as well as having efficiency. And the thing that I say about a diagnosis is that it is necessary for health professionals to be paid by insurance companies, nothing more. Nothing more than that. Aligning to empowering thoughts is really the way of changing your vocabulary. So saying I'm feeling unwell versus I'm sick. Little mantras, every day and every way I get better and better. I am light, I am free in body, mind, and energy. That's one of my mantras. I am safe and I am free in body, mind, and energy. Posture, breathing, visualization. And, give the power, focus on the healing versus the diagnosis. When someone is feeling unwell, for example, you could also say that my immune system is getting a workout. There's a more vibrational way to speak. And I've been really studying the energy of words and use them quite a bit in my coaching practice. Now we're going to talk about some mystery diagnoses. And this was a soccer player came to me with foot and ankle symptoms. She was in a boot for several months. And she had an MRI, kind of inconclusive. It was just a strange diagnosis. And while my body work demonstrated improved pain-free motion, her symptoms continued. She had better movement. She was asymptomatic, when she left. I didn't do anything with her. This was the position that I worked with her for the majority. I stabilized the area of pain. I did everything I was supposed to do, except she didn't get better. And so after a few weeks, I reached out to the mom when I saw her in her boots still. And I felt that it could potentially be energy. And what I shared with the mom was that I felt that there was an energy situation. I was able to work on her remotely with the mother's permission. And I did the energy session on Tuesday. I felt that she would be better by Friday. And sure enough, Friday came, she wanted to play in the tournament that weekend. And the next week, she was out of the boot and back to practice without any problems since. So oftentimes when something does not work, I go to the energy and vice versa. Most people come to me, obviously for body work that has not worked or something physical. But now I'm working a lot more with energy healers. And it's kind of funny because the majority of them have done energy work and that's not working. And then I'm able to suggest body work. So it's a really kind of full circle thing that has come around because, again, I don't believe in just doing one thing. I believe in that kitchen sink philosophy. Here's the other patient I was talking about. Now, this was a woman. She was in a wheelchair for 8 months, 11 podiatrists, 4 chiropractors, physical therapists, and massage therapists. And when she contacted me and shared, and this was before I did energy work, I honestly said to her, I'm not sure that I can help you. And when she came, I did do some things that these guys didn't do. I mean, obviously my release techniques are, different than these guys. And also I incorporated some taping, some kinesio tape for her. This was before I even knew about dynamic tape. But what I think really made the difference is I gave her a meditation. And after that, she was able to stroll her grandson for 2 miles, and using the same techniques that I'm going to share with you, she was able to maintain. I never saw her again. I think I've I think I maybe had 3 visits with her. So when we're doing the first step, which is release, and release is to free. I like that word better. It's a higher, more vibrational word, actually, free. And in the body, that's connective tissue. And connective tissue can be a multitude of things. It could be fascia, it could be skin, it could be bone, it could be nerve, it could be muscle. And the truth is that I don't know what it is, but the way that I know what it is I can feel it. And it will feel oftentimes hard. And for the patient, it will feel painful. I will get what I call the positive squinch test. So if you look at my face, it looks like this, where the person is squinching, and sometimes they hit me. So in the mind, obviously that's with visualization, freeing. I like to say that I free now within myself timelines, potential timelines. And I don't give energy to those. The things that I don't want, I just don't give energy to those timelines. And obviously in the body, I mentioned, in the mind, and in energy, right? Conservation of forces, making walking easier. For some people, that'll be a rocker bottom shoe. For some people, it'll be taping. For some people, it'll be orthotics. And also the ability to absorb and transmute energy through the body, force absorption, is going to be key. And when we have subtle connective tissue, connective tissue is like the shock absorber in our body. So being very mindful of that and freeing the connective tissue, particularly if it's causing a pull in another area. Okay, so when I had worked on that patient today whose pain was in his ankle, what I explained to the mom is that connective tissue is like a sweater or like a fabric, right? If it's tight here, right, and it's pulling, what happens to here? It's also pulling. It's connected in our body, right? So if you think about, we have this like web of connection through our body where something could be restricted, say here, and it could manifest in low back pain. I get that all the time. When somebody's bending forward and they get pain in their back, it's in their rib cage. And so when you release and free that connective tissue, it takes that pull off of the back. Not always does it happen that way, but we'll see later when I share with somebody else. Anybody have any questions? And did that make sense? The sweater analogy. Everyone understand that? All right. So we have freeing, and when we are doing this, we can also visualize freeing. So as we're doing release work, right, as we're doing body work, and there are people that do this all the time, they do like talking massage almost, where they have, they do almost like a therapy when they are doing releasing. But what you can do is you can think about ice melting. Sometimes I'll do this with a patient if I'm on connective tissue and it's not releasing. I'll have them change the color from red to like blue or white, water flowing, right? Thinking of like a dam versus a nice, beautiful stream. Light, I love light. Either just visualizing light and energy activating every cell in one's body. I love that idea. I love even thinking of sunlight. And you can also use like the analogy of a balloon. If there's an emotion coming in, that you blow up that balloon and explode anger or frustration. You just make it a balloon and then it transmutes the energy. Not created nor destroyed. And obviously breathing. Huge tool. I love breathing. So breathing in, joy, light, freedom, and breathing out or expiring, putting to death, anger, frustration, irritation, those kinds of things. And doing that both in conjunction with the body and the mind. So we can incorporate many of these things all at once. So we look at the anatomy of the foot. Now, just these things highlighted on the actual foot, this is called the forefoot, and this consists of 33 joints just in here. There are 52 joints in the entire foot, and any one of them, and multiple connective tissue that extends all the way up to the spine. If we think about the branches of the sciatic nerve, for example, they go all the way into the toes. So we have a lot of areas that can require freedom of motion. Okay? And when I was taught, even in my advanced certification, I was not taught these 33 joints. And so many other people have not been addressing the forefoot. And once again, the forefoot will affect the rear foot, and the rear foot will affect the forefoot. So we have to consider this area. And restrictions here will impede upon things like ankle sprains, plantar fasciitis, Achilles tendonitis, even just our standing posture. People who have knee hyperextension called genu recurvatum oftentimes will have a problem in their forefoot. Because if the forefoot is restricted, you're still going to have your foot flat on the ground. It's just that there's going to be a compensation elsewhere. So that arching of, or that recurvatum of the knee is oftentimes to get weight over the big toe. Same thing with a slouched posture or a lordotic posture. It all comes down to the foot. It's all about the base. And there are a variety of release positions. The ones that have the foot on the ground are most functional. So if our pain is in standing, then we're going to want the foot to be in some sort of weight-bearing position, ideally, to mimic the demands of what's going on when we are getting our pain or our dysfunction. Now, that's not always possible, so this is a real nice position. This can be done in sitting, it's the figure 4, or in lying down. So you can release in any position. I have a breakfast bar at my house, and there'll be times I'm on my stool and I put my foot on the breakfast bar and I'll be releasing. I'll be releasing at the movie theater. Whenever I feel inclined, I will go ahead and get into the connective tissue because I have a side, it happens to be my right side, that is more dysfunctional than the other. And there are two types of release techniques. One is I call the comprehensive core, and the other one is rotational release, which is basically the comprehensive core with rotation. So this is a series of steps, and basically you take a releasing tool. I love the pencil. This is where you would take your pencil, and you would depress it into the connective tissue until you found a place that was tender. Okay? If it's not tender, you don't work on it. When you find a tender spot, you maintain that depth and move around an imaginary clock until you find the direction that is most tender. You then stabilize, which can be done in a variety of ways, and then you just move about it. So it's different than massage because the releasing tool in traditional massage, the releasing tool is the fingers or a ball or something, and it moves on you, where this technique, you move about it. Okay, and that's the difference because you can be very functional in your movements. So for example, if the movement of dorsiflexion, which is like what we did with the calf stretch, if that is restricted, then we can mimic our release movement with dorsiflexion. We can make it very specific. We can also change directions. We can move in rotation or figure eights. I love figure eights or clocks, right? Because we have capabilities of moving in all directions. And in the real world, that's what we have to do. Right? We're not robotic, and unless you're doing like an 80s dance, we don't function that way. And so this is why I really do feel that this is a more functional and specific principle. And there's something called specificity of training. This is specificity of treatment. Specificity of training, and I'll get to it later, is that, if you wanted to get better at skiing, you would skate. Right? You're not going to play volleyball to get better at skiing. You're going to go ahead and skate. You want to do that. So you want to do the thing that you want to improve. But if we're going to, say, a massage therapist or at the nail salon, right? It feels good, but it's not functional, right? Because we're not in weight bearing. We're just sitting there with our leg up. right? So even just treating, if I have any health professionals here, even just treating in partial weight bearing or with the sole of the foot articulating into something is better than treating in non-weight bearing. Not 95% of the time, unless the symptoms are in non-weight bearing, right? And again, this is when I get into my analysis and deal with that. Okay, does that make sense to everybody? Any questions on that? Okay. Then rotational release, it's the same thing, but you rotate first. So you rotate, then you feel for the tenderness, you depress, you hold it, and then you move. And with rotational release, we use our fingers. So if you have problems with your fingers, fine motor stuff is a problem. Then what you kind of can do with most parts of the body is that you can move into rotation, move into a rotational position, right? Or put yourself into a type of rotation that will move down from the upper body to the lower body. And I'll demonstrate that in a few minutes. So what we're going to do is we're going to do both of these. So first, I'd like to do the comprehensive core. The position, you are more than welcome to join me on this. And I will do it in partial weight bearing. So I will do it in kneeling, but you don't have to. You can do it whatever position you choose, but I'd like to demonstrate those various ways of doing things. Okay. So in the kneeling position, what I'm going to do is I am going to take my releasing tool and I depress. Everybody has a good view of this, I hope. Yeah. Okay. And feel for a tender spot. When I find it, I just found one. Ooh, that's good. And I'm going to go ahead and maintain that depth. And I'm going around an imaginary clock and I'm finding the direction. The direction for me is this way. It will not be the same for you. It doesn't matter. Now I can stabilize just like I did in standing by pushing weight into my big toe. And this tenderness should abate a little bit. Then all I do is move. So I can move my knee forward and backward. I can move my knee from side to side. I can move in a figure 8 or a circle. Okay, I am limited only by my creativity. I can move my toes. And that I do for about 10 repetitions. And that is the comprehensive core release. That is in partial weight bearing, a very functional position, great position. Okay, if I were to go into non-weight bearing, what I could do, cross my leg. I could get underneath the sole of my foot in this position. And again, I could feel for tenderness. I want to secure the other side. That's how I typically do it. Then I find the area of tenderness. I go around my imaginary clock. I find the direction that's most tender. I will stabilize by taking my hands and putting it in a diagonal position, pulling toward my body this way, or pushing away, whichever one makes this less tender. And then I will move my toes, or I can move my knee. All right. So now what I can do, recently I was in yoga class and it was yin. I don't know if anybody takes yin, but it's kind of boring. And I looked at my feet in butterfly. And what I noticed is that my right arch is higher than my left when I had it together. It's like, it's not so bad now because I've been working on it. And I was like, oh, this is interesting. So I went ahead and I felt in here and I'm like, wow, this is a great position for release. Why? It's functional because my foot is against something like a ground, right? Like the ground. And so I can take my releasing tool and release underneath the areas, again, that are tender and do the same thing, the comprehensive core, and then move my knee up and down. I then said, well, if I did it this way, then I could also use a yoga block, because I was in yoga class. Can put it right here into my thigh, then put my foot against it. And now I could work on my toe in a better, more functional position. Both when I'm working with patients, right? Because the other way for me to do this is have them standing or their feet off the edge, which is what I do. But now I'm going to try to show you the rotational release. Rotational release is I want to secure the ball of the foot. The ball of the foot this is where the toe starts. From the ball of the foot to the first crease. The first big bone of the big toe. The proximal hallux. Okay? And then from the crease to the tip is the second joint of the big toe. Okay? And my big toe actually rotates, so this is a very important release for me. What I can do is I can start at the ball of the foot and secure by pinching my thumb on the underside and my pointer finger on top. Then I take my other hand and I will just rotate inward and outward. And what I'll do is I'll feel for tenderness when I'm doing that and use while I'm in rotation. When I find a tender spot, for me, it's right there. I will then maintain that position, go around the imaginary clock, find the direction, stabilize, and then I'll move my knee up and down. And when it goes away, then I move on. And I continue feeling into the connective tissue around the entire joint. And I have multiple areas here. This would be a good one for me to do. Okay? So once I find it, again, I can stabilize it. I'm going around my imaginary clock. I can use my finger to stabilize. I can push into the block to stabilize. I can place the flat part of my tongue on the roof of my mouth to stabilize. And then I will move 10 times. Okay? It is a great mobilization for people who have a high arch, people who have a low arch, people who have problems with a sprained ankle, particularly because of the lateral movement. There needs to be really good mobility in here. So if you see how much I can twist this part of my foot in this direction, that's a great position for me. But even into this position, not so bad. And then again, I can feel this is another way to do rotational release for the metatarsal bones, which kind of look like seesaws. They're like a seesaw. They're the long, flat bone. They go from the beginning of the height of the arch down to the ball of the foot. And again, this is very important with regard to force absorption, very important with regard to, things like Achilles tendon issues and plantar fasciitis, and also obviously ankle sprains. To have good motion through each of the metatarsals. For me, the fifth is very restricted. So again, I'll take it into rotation. I find my tender spot, which is right under my middle finger, go around my imaginary clock, stabilize, I can go on top, and then again, I can move my foot up and down. Another way that I could do that is here. More functional. And another place that I really like to do rotational release is in the calf. Again, for ankle sprains, for a high arch, for a flat foot, you get around the lower leg, you grasp it, you rotate, you feel for tenderness, and then you can move in a variety of directions. And move up, all the way up into the knee. You can also do rotational release in the thigh. You can do, like I said, you can do these techniques anywhere in the body. They're always the same. The comprehensive core Again, we can go on top. We can go onto the lower leg. And again, I really encourage the rotational movement as we're releasing. Sometimes when you do this, what you will feel is that when you move a certain way, like for me, it's here that I have the most tenderness. When I move here, not so much. So you can kind of stay on it. But it's nice because it gives you like a little break as you're doing it. Because if it was really tender for too long, it could be very, very noxious. All right, I'm going to go back to the other camera. Okay. Yes.
I have a question.
Yes.
When you're doing the rotational release at the just above the ankle,
yes.
What is it that you're feeling moving? Is it the muscles? Is it the fascia? I don't think you're really rotating the bones. What is it that's actually moving?
Thanks. Good question. I always say I don't know. And it doesn't matter. Because I could be on muscle. I could be on bone. I've worked with people who, they'll share like, I'm on your ovary right now. How do you know? I don't, do you really know for sure? All I know is that it's stuck and I need it to move.
Right.
Yeah. So that for me is what's important. I remember one patient in particular, and she had avascular necrosis of her hip. And I definitely felt restriction in her bone. I really felt that it was a bony restriction. And again, I don't give it much thought because my intention is not to know what it is, but to have it move. And like Tony Robbins likes to say, where focus goes, energy flows. And that's my focus. So my focus is always on what I'm choosing to happen, my ideal future, right? And what I am choosing as a result of the intervention. Okay.
Yeah, because I have no idea what I'm moving, but
So,
I've used it, and it actually does help.
Yes, right. And again, that's at a point where I could incorporate things like visualization, right? If I wanted to think about ice melting or, send energy, honestly, and I've toyed with this, crystals. You can use crystals to release. If it's hard and pointy, you can use it. And if crystals are something that align to you and you feel good about using, then use them. So it doesn't have to be a pencil eraser. So moving on, these are just the directions for facilitating. Supination is a high arch, pronation is a flat foot. And we want to balance between the two. So if we want to, I have a high arch, so I want to move more into internal rotation. To facilitate more of a pronated foot. If I had a flat foot, I'd want to go into external rotation. And that would be through the toes, the metatarsals, the tarsals, the lower leg, all into external rotation, and vice versa. Okay, we did that. Now we're getting into the alignment. So remember I said that I learned 3 important principles in physical therapy school. We kind of went over the first one. The first one's in this diagram. It's actually release, realign, and reinforce. So I want to free, I want to align, and then I want to reinforce it. Okay, and we'll get into reinforcing a little bit later. When we release and realign, we rebalance actually. It just kind of happens automatically. Because alignment dictates function, frequency, flow, and force absorption. That was principle number 2. Structure dictates function was the way she put it. I say alignment dictates function due to something called the length tension ratio I'll talk about. Frequency, right? When we're aligned, think about nerve frequency traveling through the nerves. There's a point on a nerve at the end and the beginning, and if they're off alignment, they're not going to work. Same thing, flow, right? So the flow of our blood through our body. If we are compressed someplace, blood flow is not going to happen. It's going to be like a kink in our hose. And then force absorption. When we're aligned, think about it like a pogo stick, right? Very hard versus a spine, which has curves and can absorb forces. And the alignment will impact the connective tissue, which helps with force absorption. So again, the movement, everything kind of works together. And then changing your vocabulary, aligning your mind, aligning your intention to what you're choosing, right? Do I care about a diagnosis? No. Do I care about a patient's age? No. Do I care about them moving? Yes. That's my focus, right? How do I get them to move if that's the goal? What's the goal? That's what I'm focused on. Yeah, nothing else. And then in the energy, that's about the state. And we could use things like frequency and obviously the environment that we're in, right? The people that we're around. I mean, this is stuff I think that people are getting more and more comfortable thinking about and feeling about, really. And sometimes we don't even know it. It's like, it's the way that we can get moved to tears by music or a picture. You know, it's that senses through our body that cause something to shift a little bit. And we want it to shift in a good way, in a positive way, in a high vibrational way. And that's going to help us to heal. I mean, you know, back in the day where they would put patients outside to get the sunlight, right? This is nothing new, really. It's nothing new. It's just we haven't used it in a long time. And so I mentioned the length tension ratio. This is a principle, exercise physiology. I learned it when I got my master's. Muscle will contract with greatest vigor or strength when it's at a particular length. If it's too long or too short, then it won't function optimally. Very, very important, particularly with our stabilizing muscles. I talked about those earlier. When they are in the right alignment and there's a perturbation, meaning that there's a sudden trauma, a sudden shift, a push, a shove, a trip, right? They can just snap right on. I have a very funny story that I'm just feeling really inclined to share. So when I was practicing physical therapy in New York City, and I did this for 10 years, I would rollerblade to my patients. And one day I was walking down the street. I wasn't on my rollerblades. I was carrying them, but I had my rollerblades in one hand, a cup of coffee in the other hand. And I'm walking down, I think it was 33rd Street and onto Park Avenue. And there was somebody walking on Park Avenue crossing 33rd Street. What are the chances? Neither of us saw one another. We smacked right into each other. Now, he's a young guy, bigger than me, not out of shape. He says to me, "Why did you push me?" Like, how can I push you? I had my rollerblades in one hand, coffee in the other hand. My coffee did not spill, by the way. And I didn't mean to, I didn't have time to explain to him that it was that my core muscles, I was aligned. So my core muscles kicked in and he basically ricocheted off of me. Very, very important, like with football players, for example. My mentors worked with Joe Montana. Some of you might remember him from the 80s or 90s, right? When he was not able to see when he was getting hit. He was unstable. He wasn't aligned. And they had to teach him alignment. And so his core muscles could kick in when somebody would hit him so that he'd be protected. Okay. So going on to the next one about alignment. So, okay, this is what I was talking about, being moved to tears. So Helen Keller could not see and could not hear and, obviously could not speak. Sight and sound, right? So she was listening, quote unquote, to Beethoven's Ninth Symphony. And what she said is that she sensed or thought that she did the tender sounds of nature that sing into my hands, swaying reeds and winds and murmur of streams. It was the vibration that she felt that caused that emotional state to change. So I think that that's really interesting. Albert Einstein, the future of medicine is the medicine of frequencies. Now, some people are like, oh, this is, whatever. If frequencies can harm the body, they can. X-rays, right? Microwaves, yes. Then frequencies can heal the body. Same thing with the mind. If the mind can cause disease, the mind can heal disease. And as a physical therapist, I thought about it. Ultrasound, electric stim, laser, they're all energy. So why not? Music, again, does something vibrationally to us. Everything has a frequency. And so I've been playing with frequencies for a couple of years now. And it will be something that I sometimes incorporate in different situations. And for every disease, there are different kinds of frequencies that you can play, and you can download a frequency generator on your phone or on your computer for free. And I will share these resources with you more specifically via email. This was my dad, actually, and I did with him electricity, color, sound, and light wave patches, if anybody has them. And so there was the difference before and after. Much less swelling, still a little red, but significant change. I was even surprised with that. So the sound frequencies, I use an F generator. There are a number of different kinds. And then there's a website, Cisnalaski.com. My friend Jamie Westrom is on her website. This is from another resource, but there are sound frequencies. And there's frequencies for everything. Earwax, there's a frequency. Ear fungus. These are all in hertz. Immune system stabilization, hypoxia, hypothyroid, eye inflammation. So fainting, who thought? Facial paralysis. You know, guys, why not? It's kitchen sink, and it doesn't cost anything, and it's not going to hurt you. And if it doesn't feel right, then just don't do it. You know, just don't do it. That's what I tell everyone. If something does not feel right, it doesn't align, then it's not meant for you. Do not do it, including the stuff that I show you. So the stories and mindsets are changing these things. There's misconception, right? There's nothing you can do about a foot deformity. But the thing is, the body, the alignment of the body is dictated by connective tissue, not the skeleton, not only the skeleton. And we know this because if you've ever deboned a fish or had a piece of meat, like a T-bone, right? The connective tissue doesn't disintegrate. It maintains its form in spite of taking the skeleton out of it. Here's an example. Too old. Okay, this patient was in her 70s. I have a picture of a patient in her 90s. But this was her scoliosis. We changed this with connective tissue. Too much damage. Patient with 6 knee surgeries. So changing the alignment, right? Look at the stress that comes onto her knee because of her foot here. Working on her foot after 2 sessions, look at the improved alignment. And you'll see, and this is what I do to realign, is I love tape. And the different types of tape that I use, dynamic tape, which I use to just hold something in alignment. Very, very strong tape. The Black Eco has the capabilities of holding something with 33 pounds of force or absorbing forces with 33 pounds, 15 kilos. Leukotape, same thing, holds things in place. I like this better. This is more contractile. This has more freedom of motion. So if I want stability, but I still want to maintain motion, dynamic tape. If I want stability, no motion, leukotape. Kinesio tape contracts in one direction and can be used over a muscle to facilitate a contraction if it's taped one way, or relaxation if it's taped another way. And those are courses within themselves. But there are ways to help rebalance. It's kind of like doing exercise 24/7 if you have the kinesio tape on there. With dynamic tape, it's kind of like having a brace on 24/7. You're getting that proprioceptive input. It's telling the body where to stay. So I release, realign, rebalance, reinforce. Taping, a lot of reasons to use it. There are contraindications and precautions. Usually they're related to skin. Right? They're all related to skin. All right. Taping of the big toe. So I love taping the toes. And one of my favorite taping techniques I'm going to share with you is one that I've done for hip problems and knee problems and big toe problems like hallux limitus, hallux rigidus, because a lot of times there's a misalignment within the joints of the big toe, particularly with hallux limitus and hallux rigidus. Right? Usually the metatarsal is up, the proximal hallux is down, and the tip of the toe becomes like a rocker bottom shoe. It sticks up. Call that an elf toe. So what I'm going to do is I'm going to take 2 pieces of kinesio tape. I can use kinesio tape. I could use dynamic tape. But the big toe needs to move quite a bit. And if I wanted to limit it, then I would use a stronger tape. I would never use Luco. It's too stiff. But I would use dynamic, potentially. Okay? So I'm going to go ahead and share this on my screen, if I can. Okay, so what I want to do, my first piece of tape just goes along the underside of the foot. I just call this big toe down. I want to hold it into neutral, right? A neutral position. If I wanted to align the big toe joint, I would do so right here. And what I'll do is I'll just take the tip of my tape, undo it. This, by the way, was one of the tapes that kept me out of knee surgery. And I really like it for the hip too. SI problems as well. Putting the big toe down, and then I just rub the tape. Rubbing the tape heats it up, so it's able to stay on for an extended period of time. You can also use a hairdryer. Now, what I do here, and another patient population I use this with is elder Daniels. EDS, they tend to be hypermobile. This gives them nice stability, good balance through the big toe. So the next part, when I rip my tape, I rip it in the middle like a Band-Aid. So I create a hole in it and unpeel. And then I take that and I place it in between my 2 toes. And then what I do is I put the foot down and I do a crisscross over the top. Now, crisscross or X's are very good for stabilization. It's, again, when I stabilize for the CCR, comprehensive core, I go in a diagonal. And so the same thing applies here, where I want to crisscross, particularly if over a painful joint. So over the big toe joint, it's very, very effective. And so doing so will protect the joint and put me into a better alignment. And by taping the underside of the foot, I'm providing proprioceptive input into the big toe for balance. So that is big toe. Patients love this. Patients love that one. Okay? Any questions on that? So
can you explain why you would do it or under what conditions you would have your toe
balance? Yeah, so somebody who doesn't have good balance, that would be a reason that I would do it. I would also do it for, again, somebody who has pain in the big toe or a sesamoiditis, because what I'm doing is I'm creating a greater base of support for force absorption, right? So if somebody's getting too much pressure right here, like in sesamoiditis, right? What I'm doing is I'm creating more articulation onto the floor, a better articulation onto the floor so that there's greater force absorption. So versus this just getting hit, then I've created a longer lever. That would be another condition to do it. A rotated toe would be another condition. Anything to promote stability, big toe down promotes stability through the entire body. So the knee, the hip, the lower back, like I said, elder Daniels, that's with people who tend to be hypermobile, they'll lack proprioception. So kinesio taping really helps improve proprioceptive input when there's damage due to inflammation or any kind of itis. Proprioception often becomes impaired. There's a company called Nabosu. They have insoles that they're kind of waffled, and they will provide improved proprioception for individuals. So it's one of my favorite taping techniques. I use it very often. The X. So the X, again, all core muscles are stabilizing muscles. All core muscles are diagonally oriented. So to facilitate them by having that proprioceptive input are on diagonals. And an X is like half of an infinity sign. And the infinity sign, apparently I found out in energetic medicine, is used to help heal, making a figure 8 over a painful area. Again, kitchen sink. Okay? Not going to hurt you. And if it's done with intention, it's all good. Okay. Did that answer your question good? Yeah?
Yeah.
Okay, great. All right. All right, going back. So rebalancing, reinforce, figure out what works, practice and protect. So again, everybody's going to be different. Try it. As long as it doesn't hurt, if it aligns, try it. Experiment. If it's not going to hurt you to try it, then try it. I think it was Franklin Roosevelt said, it makes common sense to try something, and if it doesn't work, admit it frankly, but above all, try something. And I'm paraphrasing because he said it a lot better than I did. In the mind, practicing empowering language and thoughts, really, really listening to what you're saying and being mindful of that. And catch yourself when something, seemingly negative comes out of your mouth. Cancel, clear, delete, acknowledge it, let it go. And then in the body, applying alignment and movement principles into your daily life. There is the proper way, the more ideal way, the more functional way to stand, to weight bear, to breathe, to move. And it is about learning that alignment does help to make that happen and then practicing it. If you're in pain, it's the body's way of telling you that you're doing something wrong. So one of the first things I do is I check into my own alignment. Okay, where am I off here? What am I not doing? Sometimes I'll need tape. Sometimes I'll throw some tape on there to help, remind me where to stay, where my body's going to be. A great example is, postpartum, right? Your body has to change in order to carry a baby. You can't maintain this posture with the belly. You're going to be off balance. So what do? We go like this, right? Pregnancy belly. That happens over 40 weeks. At week 41, after you've given birth, do you think your body goes back to that position? It does not, right? You have to remind it. So again, there are taping techniques that were shared to me. I have a good friend who specializes in that area, postpartum, and some good stuff there. Okay, so, all right. So we're getting into reinforcement. And what are we rebalancing and reinforcing? And how are we doing that? So remember, we have some muscles that move and some muscles that are stabilizers. If they're stabilizing muscles, we want to train them in stabilization, right? Specificity of exercise, specificity of treatment. If something's a moving muscle, well, then we'll want to move it, right? So the towel scrunch, not functional, right? We don't really squish our toes to grab stuff, grabbing marbles. It's not functional. We want to hold things in place. So, that's what we're wanting to do, particularly if we're trying to reposition a toe, like a hammer toe or a bunion or a tailor bunion. It's a hold. We want to get it into alignment. We want to hold it. So we free first, then we realign. It's always better to reinforce when you are aligned, going back to that length tension ratio. And the same thing, if you're hypermobile, you want to stabilize. If you're hypomobile, you'll want to move. So again, it's about doing these things. Once we're released, it's kind of easy, right? If we're released and realigned, just going for a walk is our exercise. It's reinforcing. But if we're not aligned and we're not in a good position, then we're doing damage, potentially. And there are specific exercises that you can do to mimic foot function, right? Even just balancing on one foot, very functional, right? It's a great exercise for the intrinsic muscles of the foot, whose job is stabilization, particularly if you have something like a plantar fasciitis or an Achilles tendonitis. And it's good to do it with the toes hanging off the edge of a book or something. You always, if you're doing balance, you always want to be able to have something available for you to hold on to for safety. Or, like I said, just walking if that's what is going on. And so we have to consider the muscle contractions, the position, right? When we are in open chain, that means our foot is not on the ground. That's 30% of the gait, and closed chain is 70. And then obviously the sports demands and lifestyles of each individual patient is going to vary, and you're going to want to mimic whatever's involved. And so some of my favorite exercises are the big toe press, which is basically just pushing the big toe down onto the floor and lifting the 4 other toes. So I'll go ahead and bring this over and demonstrate. So lifting the 4 other toes and down, lifting the 4 other toes. This could be done at the supermarket waiting in line. This could be done while you're driving. Sometimes I'll drive with my big toe. Again, when I thought I needed knee surgery, it's because I wasn't putting weight into the big toe. That was how I avoided it. Now, I just said balancing. So if I go on here and I put my foot on the edge here and then just balance on one foot, that's another challenging exercise. Very good for the foot intrinsic muscles. I can challenge myself by closing my eyes, moving my head up and down. There are a lot of variations that can be done for that. And then the cell phone charger. The cell phone charger is one that I really like because it can be used. First of all, these things wind up not working eventually. And I hate throwing things out because I think it's not good for the environment. So I can just practice holding either at this joint, which is the proximal hallux, or I could even go to the distal hallux underneath there and practice holding. I don't want to overpower my toe. My toes are not strong. Okay, so it's a hold. And then I can go on to a angle. Either this way, very good for a bunion retraining, or this way. A very, very not so strong muscle is the extensor hallucis brevis. And just by squishing the toe and holding it there, really good exercise. Great exercise for hammer toes. The area that's hammered, we want that flat. So first we, release and then realign. And then we could hold it here and again challenge it onto multiple directions. And then we had the big toe press. Those are some of my favorites. Other ones would be to practice peeling the foot off the ground and practice pushing each segment down one at a time. And then if I want to improve ankle motion, again, figure eights. Maintaining, right, the foot onto the ground. I don't ever want to lift my foot off of the ground because then I'm losing base of support. If I lose base of support, I lose balance and proprioception. I'm more apt to damage. So again, it really depends on what the goal is. Any questions on that? And I think I forgot to pin that one. Oh well. Okay, a couple of new messages. So with hammer toes on the second toe right foot, is that an indication of a weak big toe? Oftentimes, a hammer toe will form for 2 reasons. One is that either the metatarsal, right, the metatarsal being this bone right here, is on an angle. So what happens is that if this is too far down, then the next joint goes up and then the tip goes down. That's the hammer. That's structural. A non-structural is that they're not getting good balance, so that they will grasp into the floor with their 4 other toes because they're not getting weight into the big toe. For the figure eights and ankle mobility, do you keep your knee or legs straight? You can, or you can do it bent. It really would, again, I think, depend on the demands of the sport that you're dealing with or the situations, right? So yeah, you can certainly do both. When it's in the foot, yeah, it'll change just because there's some connective tissue that crosses the knee. Actually, there's only one. It's the gastroc. It's the Achilles muscle. Okay. Anybody else? Orthotic. So, yeah, for figure eights. Okay, with regard to orthotics, I do not make orthotics. I do recommend them for certain people. I see them more as a training device than something that should necessarily be used for the rest of one's life. So when it's used, if you got the download of the 8 steps to end pain, you want to protect the joint. And orthotics may help you do that as you are recovering. But I do believe that orthotics are kind of like medication, right? Should be used in conjunction with treatment in order to wean off of the orthotic. Because the truth of the matter is that you can't wear them all the time. There are some people too with safety where balance will be enhanced with an orthotic or shoes. I had a patient like that where, when she would get up in the middle of the night to go to the bathroom, she needed to use her cane because her balance was poor when she was not in orthotics. When she was in her orthotics, she was able to walk without requiring a cane. So those are reasons why you want to do an orthotic. And also with regard to alignment, right, is the problem with there is taping to help optimal ankle alignment. Yes. The cause of pronation, to get the big toe on the ground, what's the cause? It's to get the big toe on the ground. So again, the human body will do anything to get the big toe on the ground. When you take a pronated foot and you take them out of pronation, the big toe will come off the ground. So their body is compensating. It can compensate at what's called the subtalar joint. It can compensate here. It always compensates here, actually. And usually it's because this joint right here between here and here does not move. So this one compensates and drops down. Great. You are welcome, Renee. And pronation can also occur or be compensated for at the heel and the lower leg. So that's why that happens. You have to, again, take them out of compensation first, then address the big toe getting down, and then maintain that alignment with an orthotic. But you have to remove the root cause first. We'll bid everyone a good night if you're having a night or morning, wherever you are. And thank you. This was a lot of fun. And I'll be better even next time. And anytime I repeat this, you'll always be invited.
Thank you very much.
Thanks, Arlene. Always a pleasure. Thanks, Steva. Thanks, Helga. Thanks for showing up. James. See you all in Corrective Size. And next week we'll be doing our Q&A. So come on. It'll be 7:30 Eastern Time. All right. Take care, everyone. Thank you again. Much love.
Thank you.
Bye.